but I do want to introduce our next UHW uh, board member and also a member of Leaders to Lawmakers, Ms. Stacy Lopez, who's going to bring on our next panelist.
Good afternoon, everyone. My name is Stacy Lopez, and I am a representative of Leaders to Lawmakers. So I would like to not really waste any time in bringing on our next member, Ms. Assemblymember Lori Wilson, who represents California's 11th Assembly District, which includes Contra Costa, Solano, and the Sacramento counties. She is the first Black female mayor to serve in all Solano County. During her tenure as the mayor of Tucson City, she successfully implemented a number of public health and safety initiatives to ensure that residents were able to stay safe and healthy throughout the pandemic. As part of the pandemic response, Lori worked with Tucson City Fire Department in coordination with Solano County Public Health and Office of Emergency Services to bring in free COVID testing to Tucson City. Under her leadership, her city works with the Community Action Partnership of Solano County to house the homeless against exposure to COVID. Additionally, Assemblymember Wilson worked with partnerships with the police and Solano County Behavioral Health to assist those who are homeless and contracted for Cardisto mental wellness app and to improve mental health responses. Throughout her career as a public servant, Assemblymember Wilson has been committed to supporting women in leadership positions. She is also a founding member of WIP Solano, a non-partisan organization formed to inspire more women to become visionary leaders in Solano County. Assemblymember Wilson now serves as the chair of the California Legislative Black Caucus. Everyone, Ms. Assemblymember Lori Wilson.
Well, good evening, everyone. Thank you. Thank you. It is such a pleasure and honor to be here with all of you. I appreciate what you do, and this topic is really important, not only from the viewpoint that I sit as chair of the California Legislative Black Caucus and recognizing the work that we do is to affirm Black Californians in all spaces, including when it comes to their health and health equities, but also just as a Black woman serving in this seat. I have the opportunity to be the first Black member from District 11 and representing this area in the greater part, only the third in Northern California in general, woman, so to speak. But recognizing I know what the impacts of this issue on Black women and how important it is for it to be at the extreme focus, because it is a generational thing and it affects us for generation. I happen to be a teenage mom is when I had my first child, and I recall working with my obstetrician, who was very helpful and recognized that as a teen I had different needs. However, at the time when I was supposed to give birth, a different doctor showed up, and that doctor treated me with disrespect, not only because of my color, but because of my age, even to the point of performing procedures, basically like, well, it doesn't matter, you shouldn't have been in this situation anyway. And it was not a positive experience for me when delivering my first child. And so I recognize the impacts of not only on the body, when you're going through pregnancy and having pregnancy related issues, but also even when you could be in the birthing space and doctors not care or not give concern for your issues. I want to have a quote real quick from the American Medical Association. It notes that it recognizes racism in its systematic, cultural, interpersonal, and other forms as a serious threat to public health, to the advancement of health equity, and as a barrier to appropriate medical care. This is AMA who's saying this. And there's evidence, and I'm sure you've heard some of these statistics before, but it says there's evidence that experience of discrimination and racism has a weathering effect on the body. In addition, chronic stress and trauma due to discrimination that occurs as early as in utero, and early childhood, also known as adverse childhood experiences, have been associated with poor health outcomes and early death as an adult. If that's just generic, if that's just general for the body as a whole, just imagine it is for Black maternal health. So this is an important issue, like I said, for as chair of Black Caucus, as well as, my role just as a Black woman in the legislature, ensuring that we focus on health equities and ensuring that Black maternal and infant health is at the forefront of the work that we do. I had the opportunity with my bill package this year is to introduce a bill, AB 22-8, and this is would require the California Department of Public Health to have as a part of its stockpile program infant formula. We saw in last year, and I don't know if you all remember and had children of that age, but we had an issue with baby formula and its supply and how impactful that was to families. Black and brown families were severely impacted, disproportionately. In fact, it said this is nearly a third of households with a baby younger than 1 said they had trouble finding formula over the course of 1 week last month. And this was according to a survey from the Census Bureau. And more than 40% said that they had only had a week's supply or less than on hand. I was just reading an article yesterday, and it was talking about how prevalent this still is. This was something that was going on last spring, and it still have families not being able to find an infant formula for any length of time. Just imagine if you only had food for 1 week, just for yourself, let alone for a child. And we also know that infant under a year having baby formula is the same as a diabetic patient having insulin. It is an absolute necessity. It's a necessary part of life. And so this bill would require that we have a stockpile, and it also take into account that it would be a diverse stockpile, that it wouldn't focus on just having one type of formula. That is part of how we got into this issue in the first place. WIC is an amazing program, and so many families take advantage of WIC all across the board. However, it did create a supply issue by focusing on a one type of brand, and that particular brand is the brand that had the supply issues later, so it exacerbated issues. So with this bill, we didn't want to exacerbate the issue of the infant formula supply. Another thing that takes into account is allows the flexibility for public health to determine how to reintroduce that formula into our marketplaces or into those places like our food banks and giveaways such as that. To ensure that we always have a ready supply that is within the expiration date. And it would maintain that we have a minimum supply based on whatever the needs are. And this will be determined of our Department of Public Health as well. So I'm really excited about that bill and how that will directly impact our families, and especially those Black and brown families who are, as I noted, disproportionately impacted by that. So that's a bill that we're currently working on. Another thing that we've done in our office, well, actually in my office, is I say our office all the time, forgetting that my time 12 years prior to being here was in the mayor's office, is we partnered with Black maternal and infant health programs in Solano County, as well as Black maternal baby showers that were hosted every year, the community baby shower, as well as supporting those organizations that supported Black young mothers. For me, that was really important, as I noted earlier, is that I happened to was a teen mom myself, and so I understood the impact that being a young mother has on their body, on your mental health, and your ability to not only continue your growth as an adult. And so it was really important for me to mentor those women, be engaged, provide support and resources, whether it was from a government point of view as a local official, if we had programs, but also personally out of my pocket, because I understood the impacts that they have, and that it has not only on them, but on their child. And so these are things that I've had the opportunity to do as a local leader, and wanting to expand here now that I'm in the assembly, be able to have legislation that impacts our communities and focus on, like I said, and particularly health equity and racial equity when it comes to health, because we know AMA has already documented that all forms of racism and discrimination have a direct impact on our body and our ability to be whole and well. And we also know that if we're not whole and well, then how can we then carry life that's whole and well? And we know that Black women are disproportionately impacted by this particular issue. And we still, it doesn't matter what our education level is, it doesn't matter our socioeconomic background, we still are struggling in this particular area. And it is definitely a time where we have to put those resources into it. And I know we're heading into, as a state, a budget deficit. You hear about it every time on the news. I think it came out that we were another 2 billion short, more short than we thought we were just last week. But at the same time, we have to find ways to preserve the funding to our local county organizations that are doing this good work, and the various nonprofit organizations that is preserved in this upcoming budget cycle. And we were at the Black Caucus right before I came here. We were having our Black Caucus priority budget meeting, and we talked about the preservation of these types of programs and how important it was, and that will be included in our priority letter to our budget leaders, the speaker and the Senate Pro Tem, as well as to the governor's office, that there will be a preservation of programs that relate to health and racial equity, including our Black maternal and infant health programs. And so with that, I thank you so much for the opportunity to share, and look forward to being a part of the discussion and any questions that you may have.
Thank you, Assemblymember Wilson. We are so happy to have you here, and it sounds like we're getting everything fresh off the presses for you as it pertains to the California Legislative Black Caucus as well.